Hi, I'm Robert Klein. I'm a medical doctor here in Santa Barbara, California, board certified in internal medicine and rheumatology, and been in practice for many years here. In fact, just recently I finally retired. But over the course of the years, I've treated many, many thousands of patients with a variety of joint problems. And one of the most difficult cases I ever treated was my wife. And I'll tell you more about that in a minute. But the way I got into Avacen was I was hiking up in the foothills here one day, and I ran into one of my old patients. And he told me about using Avacen himself and his girlfriend using it and having remarkable results with their joints. And I had never heard of this device, and it seemed like a very unusual way of treating joint pain to me, seeing as I was a rheumatologist and used to the traditional ways of treating things. But it piqued my interest, and I thought, well, it's worth finding out more. So I looked at the website, I called the CEO and talked to him, and I also called Dr. Newman in Beverly Hills to talk to him about his experience. And I decided to try to treat my wife because she's a very tough patient. And there's an old adage in medicine, the doctor who treats himself as a fool for a patient, and the same is sort of true with treating your own wife or family. It's always a challenge. But she had terrible arthritis in her hands to the point where she had to give up gardening, she had to give up chopping vegetables and piano, and she had to wear splints on her hands and wrists nearly constantly because it was so painful. And I had treated her with injections, with physical therapy, with splints, all the traditional things, and nothing was really helping. And anti-inflammatories, of course. And so when I heard about the Avacen, I thought, well, it's worth a try. So I got one of the units and she started using it. And to my amazement, she started getting better. And it didn't take long. It was really only a matter of 3 or 4 days before she noticed that the pain and swelling was diminishing, that her ring, which wouldn't come off her finger, was suddenly able to come off, and that she was able to start flexing and using her hands again. And you know, when I saw this and saw that it continued, as long as she continued using the device for about 20 minutes twice a day, I was really impressed. And I decided, you know, maybe this is really something that's revolutionary. So I called Tom Muehlbauer, and I decided to kind of be like Johnny Appleseed with these machines. I purchased 4 of them and sent them around to a variety of patients, friends, people with various aches and pains and joint problems. And just about everybody came back with a positive report. And this just amazed me. You know, it didn't matter whether it was a knee, an elbow, or shoulder, but anything where there was an inflammatory response and swelling and pain, the typical kinds of things treated with anti-inflammatory medications, it was helpful, and sometimes dramatically so, as with my wife. So I became really convinced that this was a real amazing non-medicinal way of treating these patients, and I felt it was very important to get this out there and to be part of it. So I actually found out that it was possible to buy into the company, which I did substantially, and became a member of the board of directors, and have served on the board of directors now for about 2 years. And I've been watching the company develop its new model, which is terrific, and gradually improving the way in which the model works and the way in which patients are treated. And I've been just so impressed with it that I'm always enthusiastic about having other patients try it, because it just seems like it's very beneficial, and it's just worth the effort of trying it because it has no side effects. And it's something that's remarkable, and many patients are able to stop taking some of their medications. So that's it. I've become a believer, and I would encourage anybody who has any of the conditions that it's approved for to give it a try.